Hi, I'm Dr. Ori Nagy. I'm a neurosurgeon. I work in Las Vegas, Nevada. In early 2020, I was working as a neurosurgeon in the ICUs around the city, and I became overwhelmed with a number of patients who I saw who were on ventilators, filling the ICUs, fighting for their lives against COVID. They were filling the medical ICU, they were filling the surgical ICU, and they were spilling out into the emergency rooms, all with COVID, most of them on ventilators, and many, many of them about to die. And we worked hard to try to find out what could we do. And a group of doctors and I started sending emails and text messages back and forth to each other because we were desperate to do something. We started to notice that there were certain people who got very, very ill from the disease and other people who just shrugged it off like it was nothing. And after studying things for a while, it became clear that you could tell who was going to be in one category and who was going to be in the other category. And so we decided to go forward and develop a test for that, and we patented that. And it looks like it's pretty straightforward. It's a functional assay, and you can identify if you were somebody who's susceptible to the disease and needs to go out and take extra precautions. And there are other things you can do to help help to prevent from getting the disease if you're susceptible to it. But if you're not susceptible to it, you don't have to go and do those things. You can get back out into society and enjoy your life, which we thought would be great for people. While we were working in the ICUs, we also saw there was a problem with the way that the testing was being done for the disease. People would come into the hospital, they'd be there for 3, 4, 5 days and not know if they actually had COVID or not. They were running PCR tests because that was felt to be the gold standard of whether or not you had the disease. And the results just took too long to get back. That's a DNA-based test. The antigen-based test, the testing to identify a surface protein on the virus, they're faster, but now that we're in the setting where there are multiple strains of the virus, it's not certain that the strains of the virus will always detect whether or not patients have it. And so we developed a test based on RNA that can work faster than the current RNA-based tests, but that should be more accurate and more reliable than the viral test because it will still detect the presence of disease even if the viral proteins shift. It's based on the fact that single-stranded RNA conducts electricity at a certain speed, but when it finds its matching complementary pair, the resistance drops dramatically, and therefore you can use it to identify specific strains of the virus, all in the same testing kit. The design that we used is much more robust than prior designs, and we're excited to be able to offer that to people. Of course, we can test for the disease and test for susceptibility to the disease, but that still leaves people who actually have the disease and are dying from it the need to have something done for them. And so we started to look at what are the mechanisms by which this disease operates, and we identified that there are 2 phases to the disease. The first phase is the viral replication phase. So, and that is the early stage of the disease, and most people, that's all they see in this disease, and they get over it. And the second stage of the disease is when people don't get over the viral replication and can't terminate it appropriately, and the body has an overactive immune response. And in this situation, the process is called a cytokine storm. The cytokine storm is what most people go on to die from, and this overactive immune system is fatal for many people. The body of scientists who have been studying treatments for this disease recognized that and thought that the right treatment was to use a drug called tocilizumab, which is an antibody designed to bind to IL-6, and that would prevent it from binding to the binding sites in the body. And we thought this was going to be a great treatment for the disease, and we're excited when it came out, and then it turned out it didn't work, and at least not in the way that they thought it would, and it was not nearly as effective as it should have been. And so we were left scratching our heads as to why that happened. And finally I reasoned that, the reason that tocilizumab isn't as effective as it ought to be is because it's too big of a molecule and it can't fit out the tiny apertures in the capillaries. So we identified a molecule that's capable of getting out to where it needs to be and that downregulates the activity of the body's immune response to interleukin-6, and that shuts down the cytokine storm. So it turns out we gave that drug to patients who were sick enough that they required hospitalization for oxygen supplementation. And we had a 68% survival rate, 68% improvement in survival rate over current standards of care, with a 37% reduction in length of hospital stay. So what that means is that had this treatment been available at the beginning of the pandemic, up to 2/3 of the people who died wouldn't have had to die. And so we really want to get this out there to people in the future so that, we can save a lot of lives. When we went back and looked at the data, we saw that the people who still went on to die, even though they'd gotten the treatment, had actually initially had a response, but then they started to succumb to the disease again. And we reason that looks like it's happening because they are continuing to have viral replication. And so we thought the best thing to do was to take the drug that we identified and combine it with a best-in-class drug for termination of viral replication. And the two together is a drug that we've now patented, and we're trying to get people to help us to get out to as many doctors as possible to save as many lives. So the susceptibility test that we developed is called COV-Assess, because we're assessing somebody's susceptibility to the disease. The test that we created for identifying whether or not somebody has COVID is called COVID-Test, because we're testing to see if you have the disease. And the treatment that we developed to stop the cytokine storm and to stop viral replication, we called COV-Arrest, because it arrests the process of the disease, and that's what's been saving lives. So I'm just a local neurosurgeon out here working with just a couple of doctors, and we discovered this treatment for COVID, and we discovered this saves lives. But we're in the business of being doctors taking care of individual patients. We're not in the business of producing drugs and getting patents and FDA approvals and distributing this all over the world. And we need help from people who know how to do those kinds of things with expertise like that to help us get this out there to everybody who needs to know about it so we can save the lives of as many people as possible.